Question 1. Why is it important for a CNA to ask a patient to choose their clothes when assisting with dressing? A. It speeds up the dressing process. B. It allows the CNA to select the most suitable outfit. C. It promotes the patient's autonomy and respects their preferences. D. It ensures that the patient is dressed according to hospital policies. You have 10 seconds to choose the correct answer. The correct answer is C. It promotes the patient's autonomy and respects their preferences. Allowing patients to choose their clothes helps maintain their dignity, independence, and personal preferences. It also fosters a sense of control, which is essential for their emotional well-being, especially in healthcare settings where they may feel a loss of independence. Additionally, involving the patient in decisions about their clothing can enhance their self-esteem and provide a sense of normalcy. It reassures them that their opinions are valued and encourages a more positive caregiving relationship. Are you looking for CNA exam preparation tips, study guides, or practice questions? Here's a breakdown to help you prepare effectively. Certified Nursing Assistant CNA Exam Overview. The CNA exam typically consists of 2 parts. 1. Written or oral test, multiple choice questions covering nursing principles, safety, patient care, and ethics. 2. Skills test, a hands-on demonstration of essential CNA skills such as hand hygiene, taking vital signs, or assisting with mobility. Key topics covered in the CNA exam: basic nursing skills, taking vital signs, infection control, hand washing, personal care, bathing, dressing, feeding patients, safety and emergency procedures, fire safety, handling emergencies, mental health and social needs, dealing with dementia, patient communication, legal and ethical aspects, patient rights, HIPAA, workplace conduct. Restorative skills, range of motion exercises, assisting with mobility, study tips for CNA exam success, review CNA textbooks and state guidelines, focus on key concepts and regulations in your state, take practice tests, use CNA exam prep books or online quizzes to test your knowledge, watch CNA skill videos, observe correct procedures for hands-on tasks, practice hands-on skills, work with a study partner, or use a checklist to master skills like transferring patients or measuring vital signs. Stay calm and confident. The skills test can be nerve-wracking, but confidence and practice will help. Question 2. When transporting dirty linens to the laundry hamper, what is the recommended way to handle them? A. Fold them neatly before placing them in the hamper. B. Hold them away from your uniform. C. Carry them close to your body for balance. D. Place them directly on your uniform for convenience. You have 20 seconds to choose the correct answer. The correct answer is B. Hold them away from your uniform. Holding dirty linens away from your uniform helps prevent the spread of germs and contamination. Linens can carry bacteria, bodily fluids, or other contaminants, so it is essential to handle them properly to maintain hygiene and infection control standards. Always place them directly into the appropriate laundry hamper without shaking them to minimize airborne contamination. Additionally, it is important to wear appropriate personal protective equipment, PPE, if necessary, such as gloves when handling soiled linens to reduce the risk of exposure to infectious materials. After handling dirty linens, always wash your hands thoroughly with soap and water or use an alcohol-based hand sanitizer if hand washing is not immediately possible. Following proper linen handling procedures is a crucial part of infection control in healthcare and other environments where hygiene is a priority. Hey, future CNAs, welcome to CNA Care Academy, where we help you succeed in your CNA journey. If you're finding our content helpful, don't forget to like, share, and subscribe. Follow us on YouTube and TikTok for the best CNA tips, skills, and exam prep. Your support helps us keep creating valuable content for you. Let's grow together. Hit that subscribe button now. Remember, mastering your CNA skills happens one skill at a time. This question has been asked in the most recent CNA board exam. Listen carefully. Question 5. What is the primary purpose of using a watch with a second hand when measuring pulse beats? A. To track the time of day. B. To accurately count the pulse beats per minute. C. To measure blood pressure. To determine body temperature. You have 20 seconds to choose the correct answer. Correct answer: to accurately count the pulse beats per minute. Explanation: a watch with a second hand is essential for measuring a pulse because it allows the healthcare provider to count the number of beats in a specific time frame, usually 30 or 60 seconds. By doing so, they can accurately determine the patient's pulse rate, which is crucial for assessing heart rate, rhythm, and overall cardiovascular health. An accurate pulse measurement helps in detecting irregularities such as arrhythmias, tachycardia, or bradycardia, which may indicate underlying health conditions. This question has been asked in the most recent CNA board exam. Listen carefully. Question 4. Which of the following systems in the human body is primarily responsible for the process of defecation? A. The circulatory system. B. The respiratory system. C. The digestive system. D. The endocrine system. You have 20 seconds to choose the correct answer. The correct answer is C. The digestive system. The digestive system plays a crucial role in processing food, absorbing nutrients, and eliminating waste. Defecation is the final stage of digestion, during which the body expels undigested food, bacteria, and metabolic waste products through the rectum and anus. This process is regulated by the large intestine, which absorbs water from the remaining material, forming solid feces. The rectum stores the feces until nerve signals trigger the defecation reflex, coordinating the relaxation of the anal sphincters for waste expulsion. The nervous system, particularly the enteric and autonomic nervous systems, also plays a key role in controlling bowel movements, ensuring regular and efficient waste elimination. This question has been asked in the most recent CNA board exam. Listen carefully. Question 3. What is the primary physiological process referred to as defecation? A. The absorption of nutrients in the intestines. B. The elimination of solid waste from the body. C. The breakdown of food in the stomach. D. The secretion of digestive enzymes. You have 20 seconds to choose the correct answer. B. The elimination of solid waste from the body. Explanation. Defecation is the final stage of the digestive process in which the body expels solid waste, feces, through the rectum and anus. This waste consists of undigested food particles, bacteria, mucus, and dead cells, which accumulate in the colon and are compacted into stool. The process of defecation is regulated by the nervous system and involves coordinated contractions of the colon and rectal muscles, along with relaxation of the anal sphincters. The urge to defecate is triggered when the rectum fills with stool, stimulating stretch receptors in the intestinal wall. Maintaining regular bowel movements is essential for digestive health. Factors such as adequate fiber intake, proper hydration, regular physical activity, and a balanced diet play a crucial role in ensuring smooth and healthy defecation. Irregularities in this process can lead to conditions like constipation, diarrhea, or irritable bowel syndrome, IBS. This question has been asked in the most recent CNA board exam. Listen carefully. Question 6. What are the 4 components commonly referred to as vital signs? A. Height, weight, temperature, and blood glucose. B. Temperature, pulse, respirations, and blood pressure. C. Blood pressure, cholesterol, heart rate, and temperature. Respirations, body mass index, temperature, and weight. You have 20 seconds to choose the correct answer. All right, the correct answer is B. Temperature, pulse, respirations, and blood pressure. Explanation. Vital signs are key indicators of a person's basic bodily functions and overall health status. The 4 primary vital signs are temperature, T, measures body heat and helps detect fever, infections, or hypothermia. Pulse, assesses heart rate, rhythm, and strength, which can indicate cardiovascular health or irregularities. Respirations, R, evaluates breathing rate, depth, and effort, which is crucial for detecting respiratory distress, lung conditions, or metabolic imbalances. Blood pressure, BP, monitors the force of blood against artery walls, helping detect hypertension, high blood pressure, hypotension, low blood pressure, and potential circulatory issues. These vital signs provide critical information that helps healthcare providers diagnose medical conditions, monitor treatment effectiveness, and make informed decisions about patient care. Regular monitoring is essential for early detection of health problems and timely intervention. This question has been asked in the most recent CNA board exam. Listen carefully. Question 7. Why are vital signs important in medical practice? A. They help estimate the patient's age. B. They provide a quick assessment of a patient's immediate health status. C. They are the only indicators of chronic health conditions. D. They are used exclusively for diagnosing respiratory diseases. You have 20 seconds to choose the correct answer. All right, the correct answer is B. They provide a quick assessment of a patient's immediate health status. Explanation. Vital signs, temperature, pulse, respiration rate, and blood pressure are fundamental measurements used in medical practice to assess a patient's current health status. They serve as essential indicators of physiological function and can reveal early warning signs of medical conditions such as infections, heart problems, respiratory distress, or shock. Key reasons why vital signs are important: early detection of medical issues. Abnormal vital signs may indicate infections, cardiovascular problems, dehydration, or other medical concerns requiring immediate attention. Guiding treatment decisions. Physicians and nurses use vital signs to determine the urgency of care and the effectiveness of medical interventions. Monitoring patient response. Changes in vital signs help track a patient's progress and response to treatment, allowing for necessary adjustments. Establishing a baseline. Routine vital sign monitoring provides a reference point for future assessments, helping detect trends in a patient's health. In contrast, the incorrect answers reflect misconceptions. A. Estimating age. Vital signs are not used to determine a patient's age. While some parameters may change with age, they are not accurate age predictors. C. Indicators of chronic conditions. Although vital signs can reflect chronic conditions, e.g., hypertension, they are not the only indicators. Laboratory tests, imaging, and patient history are also needed. D. Exclusive to respiratory diseases. While respiratory rate and oxygen saturation are crucial in respiratory conditions, vital signs assess overall health, not just lung function. Regular monitoring of vital signs is essential for timely medical intervention, ensuring patient safety and improving health outcomes. This question has been asked in the most recent CNA board exam. Listen carefully. Question 9. What is the primary benefit of administering antiviral medication within 48 hours of flu symptom onset in healthcare settings? A. It prevents the need for vaccinations. B. It significantly reduces the severity and duration of the illness. C. It eliminates the risk of transmission to others. D. It guarantees full recovery from the flu. You have 20 seconds to choose the correct answer. All right, the correct answer is B. It significantly reduces the severity and duration of the illness. Administering antiviral medication within the first 48 hours of flu symptom onset can be highly effective in reducing the duration and severity of symptoms. This early intervention is particularly crucial in healthcare settings where patients, especially those at high risk, such as the elderly, immunocompromised individuals, and those with chronic conditions, may face serious complications. Timely antiviral treatment can also help lower the chances of flu-related complications, such as pneumonia or hospitalization. While antivirals may help reduce viral shedding and thus lower transmission rates, option C, they do not completely eliminate the risk of spreading the flu. Additionally, antiviral medications are not a substitute for vaccination, option A, which remains the most effective preventive measure. Finally, while antivirals aid in recovery, they do not guarantee complete recovery from the flu, option D, as individual responses to treatment may vary. This question has been asked in the most recent CNA board exam. Listen carefully. Question 8. Why is early detection of flu symptoms considered crucial in healthcare settings? A. It helps in reducing hospital stay duration. It allows for the administration of antiviral medication within 48 hours. C. It decreases the likelihood of flu outbreaks. D. It ensures accurate diagnosis of flu strains. You have 20 seconds to choose the correct answer. All right, the correct answer is B. It allows for the administration of antiviral medication within 48 hours. Early detection of flu symptoms is critical because antiviral medications such as oseltamivir, Tamiflu, and Zamivir, Relenza are most effective when started within 48 hours of symptom onset. These medications can significantly reduce symptom severity, shorten illness duration, and lower the risk of serious complications, particularly in high-risk groups such as the elderly, immunocompromised individuals, pregnant women, and those with chronic conditions like asthma or heart disease. While options A, reducing hospital stays, and C, decreasing flu outbreaks are important secondary benefits, the primary reason for early detection is to ensure timely antiviral treatment, which directly impacts patient recovery and healthcare outcomes. Additionally, early intervention can help limit the spread of the virus in healthcare settings, protecting both patients and medical staff. This question has been asked in the most recent CNA board exam. Listen carefully. Question 11. Understanding urinary retention symptoms. When caring for a client with urinary retention, which of the following symptoms is the nurse aide most likely to observe? A. Frequent urination with small amounts of urine. B. Inability to urinate despite a full bladder. C. Painful urination with clear urine. D. Incontinence of urine. All right, the correct answer is answer B. Inability to urinate despite a full bladder. Explanation. Urinary retention occurs when a person is unable to completely empty their bladder, leading to discomfort, bladder distension, and potential complications such as infections. The key symptom is the inability to urinate despite a full bladder. Option B. Patients may feel a strong urge to urinate, but find themselves unable to do so, or may only pass small amounts. Why the other options are incorrect. Option A. Frequent urination with small amounts of urine. This can be a sign of overflow incontinence, a condition where the bladder cannot empty fully, causing small amounts of urine leakage. However, it is not the most defining symptom of urinary retention. Option C. Painful urination with clear urine. Painful urination dysuria is more commonly associated with urinary tract infections, UTIs, rather than urinary retention. Additionally, clear urine is not a typical indicator of retention. Option D. Incontinence of urine. Urinary retention can sometimes lead to overflow incontinence, where urine leaks out due to excessive bladder filling.